Hi, and welcome to this 1 hour webinar on day and overnight camp operations during the 2021 summer and beyond. My name's Dr. Alex Summers, and I'm the Associate Medical Officer of Health at the Middlesex London Health Unit. We continue to deal with the repercussions of the COVID-19 virus in our community, and as this pandemic gradually but inevitably comes to an end, we look forward towards day and overnight camps this summer and through into the fall. There's lots of questions out there about exactly how camps are supposed to operate and exactly what is required to be operating safely. We're going to spend some time today talking about exactly what we are expecting camps to do in order to operate safely and what you can do to make sure that you're limiting the risk of outbreak amongst your campers and your staff. Some of this is still being developed. Some of this guidance is changing in real time from the province, so make sure you check back often to see if there's any updates. And of course, you can reach out to your health unit contacts in order to ensure that you have an opportunity to answer any of the questions that you might have. But for today, let's cover what we know right now. This is our agenda for the day. We're going to talk a little bit about what to do before campers arrive, what to do when campers arrive, and what to do while they're at camp. We'll also talk about what to do about symptomatic individuals, about staff or campers who test positive for COVID-19, or about what we would do if there was an outbreak associated with your operations. In terms of where we are right now, we are at the end of the closure here in Ontario and in the Middlesex London region. As of June 11th, 2021, day camps are now permitted to operate under Step 1 of Ontario's Roadmap to Reopen. Overnight camps are expected to open in Step 2. New COVID-19 guidance documents have been released to assist in ensuring safe operation of both day and overnight camps. Those guidance documents come from the Ministry of Health as well as from Public Health Ontario, and they're listed and available on our website. I'll show you where to find those in a moment. For day camps, there are safety guidelines for day camps from the Ministry of Health. That was released at the end of May. From Public Health Ontario, there's both a pre-planning camp guidance document as well as guidance for daily camp operations. I encourage you to read through all of these documents for operators of day camps. Not only will they help you understand what you need to do, they also provide a lot of really helpful guidance around how to make sure that your venues and your operations remain safe. Overnight camps similarly have guidance documents from the Ministry of Health as well as from Public Health Ontario. I just want to highlight that for overnight camps, the guidance continues to be under review from the province. Not all of this is necessarily written in stone, and it's important that we are flexible and dynamic because things are changing very quickly. The three-step process for the reopening of Ontario is highlighted here. There are 3 steps, as I mentioned, and those steps are dependent on vaccination coverage within the population, as well as a reduction in key health indicators like COVID cases, outbreaks, and hospitalizations, as well as the use of intensive care units. Step 1 is what we're currently in, and we moved into Step 1 when we were confident that 60% of adults had been vaccinated with at least 1 dose and that we'd seen a reduction in cases. Step 2 will be considered when 70% of adults have been vaccinated with 1 dose and 20% of adults have been fully vaccinated. Step 3, lastly, will be considered when 70 to 80% of adults have received 1 dose and over 25% of individuals are fully vaccinated. The province remains at each step for at least 21 days. Step 2 at this time is proposed to kick into gear around July 2nd. However, we have to understand there may be some flexibility around that date, as is influenced by things like the variants of concern in our region and other case count numbers. As we move through the steps, it's important to note that for both day camps and overnight camps, the guidance needs to follow sector-specific requirements for each step of the Ontario reopening plan. Therefore, it's important to note that even if you're opening today as a day camp, your requirements will change as you move through each step. And similarly, for an overnight camp, the expectations will be different now than they will be 1 month or 2 months from now. As an example, let's talk about outdoor sports activity for a moment. In Step 1, outdoor sports activities allow for groups of 10 with no games or scrimmages, and 3 meters of distancing must be maintained during physical activity. No sports are permitted. So I'm highlighting this because a big part of day camps and a big part of overnight camps, of course, are outdoor sports activities. So even if your cohort is greater than 10 people, if you're participating or organizing outdoor sports activities as part of your day camp, you still have to adhere to the outdoor sports activity restrictions, which is capped at 10. That's an example of how it's important to keep an eye on all the other restrictions in different sectors, depending on your activity, because it will influence what you can do as a day camp and as an overnight camp. To check out up-to-date camp info, you can visit our MLHU website at healthunit.com. When you visit that website, you can click on the coronavirus or COVID-19 info link that's at the top of the webpage when you get to that website. Once you're there, click on sector-specific guidance, and you'll find a tab for camps, educators, and childcare centers. Within that tab, you'll find lots of resources and information that will help you as you try and navigate what you're supposed to do. If you have any questions, you can also email health@mlhu.on.ca at any time, and we'll direct you to the appropriate resources for you. Before campers arrive is probably the most important time from preparing for a safe camp experience. Public Health Ontario has released a checklist to help you prepare for your campers. It looks at how you can plan. It looks at the policies and procedures you can consider. It looks at education and training for your staff, for yourselves, and for your campers. And it looks at different ways to document and communicate in order to make sure that you're creating a safe space. It's really important that you strongly encourage all staff members and eligible campers to receive the COVID vaccine prior to the start of camp. In fact, consider making that vaccine mandatory. There are many examples now where mandatory vaccination has been strongly recommended and considered in sectors in the Middlesex London region. For example, both Western University and Fanshawe College will make vaccination mandatory for all residences this September. Making it mandatory does not mean that people don't have the opportunity to pursue, for example, a medical exemption, but it's a way of stating to your campers, to your staff, and to the community that you're taking this very seriously. Vaccination is critical, and by making vaccines mandatory or by strongly encouraging all staff members and eligible campers to receive that vaccine, you will be doing the most important thing you can do to prevent outbreak. Vaccination is the single most important thing we can do to prevent COVID-19 in our communities, in our homes, and at our camps. In addition to vaccination, it's important to organize your groups into cohorts. Please assign staff to certain cohorts in order to minimize the interactions between multiple cohorts. When we're talking about cohorts, we're talking about creating small groups that are going to stick together. And the reason that that is important is because if there is somebody with COVID-19, we're able to limit its transmission to a smaller group and avoid larger groups of campers being exposed. Consider staggering schedules to minimize cohort interactions, and this can mean different arrival times, different departure times, different lunch or snack times. These types of scheduling adjustments can make sure that those cohorts remain separate. The larger these cohorts get and the more interactions between cohorts, the increasing probability that if there is a COVID case, we'll see larger transmission that might result in the closure of the camp, which is what we want to avoid, in addition, of course, to making sure that people don't get sick. Keeping those cohorts outdoors as much as possible is impactful. Outdoors limits transmission. We see significantly higher amounts of transmission in indoor environments. So keep things outdoors, and obviously it's the summertime. Now is the perfect time for everybody to be outdoors. Who wants to be inside anyways? With regards to the cohort size, this is a bit of a moving target, admittedly, but this is pulled from the Ministry of Health's document on day camps. The overnight camps guidance is pending. For day camps, the maximum cohort sizes and staff ratios are listed in this table, and it depends on the age category. As you can see, for kindergarten students 4 to 6 years of age, the ratio of staff to camp participants should be 1 to 13, and the maximum number of participants in a cohort is 26. For primary to junior school, which is 6 years to 9 years of age, the ratio of staff to camp participants is 1 to 15, with a maximum number of camp participants of 30. For junior school, which is 9 years of age to 13 years, it's a 1 to 20 ratio of staff ratio, and a maximum number of camp participants of 20. And for secondary school students older than 13 years of age, the staff to camp participant ratio is 1 to 20, and the maximum number of participants in that cohort is 20. As I mentioned, day camp programs must also comply with applicable setting or activity-specific requirements set out in the regulations made under the ROA, which means that, for example, if you had a secondary school cohort of 20, if you were doing sports activities, they would have to be limited to 10. One of the reasons we limit it to 10 is because of the exertional effort and the heavy breathing that would happen during a sports activity, which can increase the risk of transmission. Other things to plan for include the use of space, particularly around inclement weather planning. It's really important that the cohort size must meet the requirements of indoor and outdoor spaces and permitting physical distancing. So for example, if you have a cohort the size of 20, when you move indoors, you're going to need to divide those cohorts into smaller groups, depending on whether we're in step 1, step 2, or step 3. At step 1, you're going to have to keep that cohort as small as possible and ensure 2 meters of distance. So you're going to be limited by your indoor space if you ever have to move indoors. So really consider that in your planning. It's also important to identify dedicated isolation spaces and equip those spaces with the required supplies. Isolation spaces are for symptomatic children or staff who become symptomatic during the course of your activities. They become symptomatic, it's really important for them to isolate immediately and for them to be picked up and taken for testing. Having a space that's dedicated for isolation means that you've got a plan so that when you do have somebody with symptoms, inevitably you will, you know exactly where they're going and what they're going to do. Those types of equipment can be masks, hand sanitizer, and obviously a separate space. When we talk about policies and procedures, what we're talking about is ensuring that we've got clear steps in place for things like symptom screening. Every child should be screened for symptoms before arrival. You can check out Ontario's COVID-19 school and childcare screening document as the perfect template for what you need to use before every camper arrives on any given day. If this is overnight camp, I'd encourage you to do screening every day. Obviously, kids aren't coming and going for overnight camp, but you should be screening them every day for symptoms. Policies and procedures are also relevant for personal protective equipment. What to wear, when to wear it, where to store it when not wearing. Check out these types of resources on our website that outline when and how to wear appropriate personal protective equipment. Masking is going to be a really active part of discussion. Masking is particularly important for any indoor activity, and if you're outdoors and you're not able to physically distance your cohort, they should also be masked as well. That gets a bit challenging in the summer months, admittedly, and we may see some of that guidance change over the next little while. But masking can remain and is a critical intervention to disrupting transmission in these group environments. Cleaning and disinfection is also really important. COVID-19, fortunately, does not transmit readily through third-party devices. What I mean by that is that it's hard to transmit COVID through a pen. However, it's still important to do regular cleaning of high-touch surfaces, doorknobs, tables, eating areas. Those really need to be a focus. Before camp, it's also important to educate and train your staff around appropriate hand hygiene, respiratory etiquette, the use of personal protective equipment, cleaning and disinfecting surfaces, and cleaning and disinfecting reusable eye protection if necessary. Training is really helpful so people know what to expect. And again, we have resources available for you on how to train and prepare for school and childcare settings. It's also important before camp to have a plan in place for how to contact us here at the health unit. Please provide MLHU with the name of a camp and contact information, including after hours. And the reason we ask for that is that if we hear of a positive case of COVID-19 associated with your camp, we want to be able to reach out to you as soon as possible and make sure that all the appropriate steps are taken to minimize the risk of transmission and outbreak. It's important to have an up-to-date list of staff and campers in each cohort, including notes on the siblings and other household members who might be attending camp. This helps us, if there is a case, to know who needs to isolate and who needs to quarantine to make sure, again, that we're limiting transmission. It's also important to have information about COVID prevention protocols available for families and for staff so that people know what the plans are if a COVID case shows up. All camps are required to prepare a COVID-19 safety plan outlining their procedures. And overnight camps, as per OREG 503/17, must develop and submit a camp safety plan to the Middlesex London Health Unit and notify MLHU at least 14 days ahead of opening of the name, the location of the camp, and the key contact information. There's a few extra things to prepare for before overnight camp. And as I mentioned at the beginning, overnight camp guidance continues to evolve as we prepare for July and August and overnight camps. Campers and staff at this time must limit their exposure for 14 days prior to their arrival at camp. This means limiting close social contacts in that 14-day window before going to an overnight camp. Outside of Canada, if you're arriving as a traveler outside of Canada, you must follow federal and provincial requirements and guidelines. Here in Ontario and in Canada right now, if you're an international travel coming into the country, you must quarantine for 2 weeks on arrival. And that means by yourself. So unfortunately, if somebody's coming from upstate New York to a camp here in our region, they're going to have to quarantine for 2 weeks before participating in the overnight camp. It is anticipated that there may be some additional guidance for travelers coming into Canada and the quarantine requirements if they're fully vaccinated. However, if you've got kids younger than 12, they're not going to be fully vaccinated. So you do have to adjust your requirements for people coming in from abroad. Any camper or staff that's symptomatic prior to camp and unable to arrive on their scheduled day must have proof of a negative test, be symptom-free for 24 hours, and not be in quarantine or isolation in order to start at camp. So of course, if somebody develops symptoms within the couple of days before they arrive at camp, we really need to see a proof of a negative test and make sure that they no longer have symptoms. Before camp, it's also important to make sure that you have signs in place encouraging physical distancing, hand hygiene, PPE use, etc. It's very important to make sure that those are age relevant and that the language is culturally appropriate as well. It's important to indicate a maximum capacity for each space that you're going to be using. Again, physical distancing is supposed to be possible within these indoor spaces, so make sure that you are understanding how many people you can reasonably fit within a room while still maintaining 2 meters of distance. The signs can also provide, as I mentioned, reminders of public health measures like hand hygiene, mask use, and the importance of physical distancing. It's really critical that camps have infection prevention and control measures in place. Ensure that you're, as I mentioned, frequently cleaning high-touch surfaces and that you have supplies in place to make sure that disinfection is possible at least twice a day. Minimize the sharing of objects and supplies where possible, and use cleaning products with a drug identification number on the label. This means that it's actually legitimate cleaning product. Emphasize hand hygiene by washing hands with soap and water as often as possible, or using an alcohol-based hand rub when soap and water is not available. And most importantly, for your campers and for your staff, stay at home from camp if you're unwell or have been exposed to COVID-19. As I mentioned, screening people on arrival is absolutely critical. All individuals, including children, parents and guardians and staff, must be asked questions about symptoms and exposure upon arrival. Daily screening records and attendance must be maintained in the case of a COVID-19 exposure. This is for your safety and for your camper safety as well. This screening doesn't have to happen beforehand. It can happen on site with a screener asking questions of the individual. But you can also do it beforehand with an online screening tool before coming to camp. Signing, as always, is important. Take a look at the Province of Ontario screening tool, or you can create your own using the same question with websites such as SurveyMonkey, Google Forms, Checkmarket, etc. As I mentioned, preparing is absolutely critical for a successful camp season. When campers arrive, it means you're ready to go. And when campers arrive, it's important to do that screening, it's important to keep daily attendance, and it's important to direct cohorts to appropriate areas to avoid mixing as much as possible. Make sure that you have physical distancing and face covering mandates in place and policies and procedures around this. Campers and staff should maintain a distance of at least 2 meters from each other as much as possible. Being outside is absolutely critical to minimizing the risk. Kids and staff should bring multiple face coverings to camp in case the one they're using gets wet or dirty. If there are individuals who are unable to wear a face covering to camp for different reasons, it is important to make sure that you respect that individual and their situation. A majority of people can tolerate wearing a mask, and a majority of kids can. What we've learned over this past year and a half is that kids are adaptable, and they can certainly wear masks with comfort. A majority of situations, you're not going to have an issue with this, but again, we're trying to create safe spaces and comfortable spaces, and so we have to be flexible at times. For adults, non-medical masks are expected indoors. And for staff, we recommend and expect surgical masks or procedural masks to be worn. If you are unable to wear a mask, you must physical distance. Surgical procedure masks and eye protection are required if you're unable to maintain physical distance or if you're engaging with an individual not wearing a mask. It's required outdoors when physical distancing of at least 2 meters cannot be maintained, and it's encouraged otherwise. So just to highlight again around masks. Staff need to be wearing masks and eye protection. When you're outdoors, I would recommend wear a mask. Eye protection you can probably get away with, but make sure you're keeping those 2 meters of distance as much as possible. Masks are going to be a big part of our summer this year, and we recognize that masks in the summer are no fun, but they make a big difference. We may find that recommendations change once we see fully vaccinated individuals more prevalent in our communities, but for now, masks remain really critical. Indoors, masks become even more important. For camps held in recreational facilities, event spaces, community centers, or museums, masks are required for anyone over the age of 2. Outdoors, masks are not required for campers if appropriate physical distancing and cohorts are maintained. So as I mentioned, masks for staff are strongly encouraged outdoors. They're not required for campers. I think one of this acknowledges that campers, they're going to be out running around, and we want to make sure that that's a reasonable thing for them to do. But if they are starting to be in close proximity with one another, then masks are really important. When campers are at camp, make sure those indoor spaces have increased ventilation as much as possible. Make sure your HVAC systems are up and running. If you're using a facility that hasn't been used for the course of the winter, get it tuned up. Portable fans and AC units can be used, but it's important to direct air upwards and clean and maintain units. And again, this is about making sure that we're not kind of causing a closed circuit for air circulation where we're just transmitting potential virus within the group. Sports and physical activity, well, at this point, it looks like it's going to be outdoors only, and you'll note the question mark there. Some of this is changing depending on the different steps that we move through. Right now, in step 1 and step 2, outdoor activities and sports and physical activity are only permitted outdoors, not indoors. We may see this change over time, but for step 1 and step 2, sports and physical activity is only permitted outdoors. No team sports are permitted at this point, and no games at this point. Drills are allowed, but physical distance should be maintained at 3 meters between each participant in those activities. Some of you will be participating in musical day camps, which is really exciting. I grew up playing the trumpet, and so I absolutely know the benefit of these brass instruments. But again, let's do it outdoors. There's something awesome about playing music in a park. Let's look at playing outdoors. And so that's where singing and playing wind brass music instruments can be permitted. Impermeable barriers between individuals or 3 meters of physical distancing is required even outdoors. So go outdoors, keep the distance, and sing your hearts out. From a food perspective, it's really important, whether COVID times or not, that hand hygiene is performed before and after handling food. Food to be provided by campers or not must be individually packaged, distributed by a single staff member, or consumed outside if possible. Keep that physical distancing when food is being eaten because we want to keep the distance, and masks are going to be off. We're now going to spend some time talking about how you deal with symptomatic individuals and a positive case of COVID at a camp. You are going to inevitably have somebody with symptoms at a camp. Our hope is that you don't have positive cases, but let's talk about what we'll do if it happens. If a camper or staff becomes ill, The ill individual must be rapidly isolated away from others in a designated room or area and under supervision to make sure they remain well. If at an overnight camp, ensure that an ill individual is isolated in a separate space from the regular health center or first aid facility, because you're going to still want access to that space for non-COVID related things. Wear a medical mask if tolerated for the ill individual. They must be cared for using full personal protective equipment, which includes a medical mask, eye protection, gown, and gloves, and where possible, kept at 2 meters of distance. This is hard for kids. No kid likes to be isolated at the best of times, and certainly not isolated while somebody's trying to keep their distance from them. So talk to them about what to expect if they become ill. So just to highlight, the child should be put in a designated room under supervision. They should wear a medical mask, and the person caring for them should be wearing full personal protective equipment, including a medical mask, eye protection, gowns, and glove. The ill individual should then be sent home or picked up from camp by the parent or guardian immediately and tested for COVID-19 as soon as possible. After the individual goes home, it's important to clean and disinfect the isolation room or area and places where the ill individual was present. Remove and dispose of your PPE appropriately and wash hands thoroughly. If the camper ends up testing negative or receiving an alternative diagnosis for their symptoms, they should still be excluded from camp activities until they've had 24 hours of symptom improvement. If, unfortunately, a camper or staff tests positive for COVID-19, please report positive cases to us at the Middlesex London Health Unit immediately by calling 519-663-5317, extension 9012. If you forget the extension, that's no problem. You'll be directed when you call. So really important to remember to just call the Middlesex London Health Unit. It is likely that we will have also received report of that case, but we'll be trying to figure out exactly where they've been. So giving us a call helps us be even more rapid in our response to provide guidance to you. As a camp, you are expected to record and make available the attendance records, the cohort lists and seating charts, the before and after childcare lists, up-to-date contact information for parents, staff, and camp participants, as well as transportation lists and seating charts. As public health, we use all this information to determine who's been exposed to the positive case and whether or not they need to quarantine. It is really important for camps to provide public health with after-hours contact information in the event that cases are identified outside of regular camp operating hours, and that after-hours contact should be able to identify and pull all this record information so that public health can start its investigation. As mentioned, it's really important that camps provide their contact information to us. The following information, the following email, can be used to submit your information to us at MLHU. Email covid.outbreakfacilities@mlhu.on.ca and provide your camp name and address, the name of the contact person's phone number and email, and if applicable, include any alternate contact. And again, that email, as listed here, is covid.outbreakfacilities@mlhu.on.ca. If the case that attended camp was there while infectious, close contacts will need to be identified by camp operators in collaboration with public health. We will work with you to help understand who in the camp has been exposed potentially to COVID-19. We'll then assist in excluding those close contacts by providing camp operators with a letter that can be forwarded to affected campers and staff. This letter will outline what is expected from campers and staff with regards to how they need to quarantine and for how long. It also provides them direct contact information with the Middlesex London Health Unit if they have questions or concerns. We will also try to reach out to as many contacts as possible, but the letter through you remains the key thing for us with regards to rapidly quarantining people who may have been exposed. Those exclusion letters, as I mentioned, will have instructions on isolation dates, testing date recommendations, as well as guidance for monitoring for symptoms and household member direction as well. Cases who are actually positive for COVID-19 will be followed directly by public health and provided with significant instructions on isolation and when they can return to normal activity. Unfortunately, every once in a while, we must declare an outbreak of COVID-19 in different facilities and amongst different groups. An outbreak is declared if, within a 2-week period, there are 2 or more laboratory-confirmed COVID-19 cases in campers, staff, or other visitors that are linked. In other words, if you had 2 or more campers within the same cohort, we would be declaring an outbreak. The reason we declare an outbreak there is that we think that one case likely got it from another, which suggests to us that transmission of COVID-19 has happened within a camp. We're not just going to declare an outbreak when you have one case within your facility. It's likely, potentially, that that case was exposed elsewhere and became infected, not at camp. But if we start to see more than a couple of cases within a cohort, we start to worry about transmission within the cohort, and that's where we would declare an outbreak. When we declare an outbreak, we often have to do more extensive outbreak measures because at that point in time, we are no longer able to quarantine and isolate people one by one. We start to have to quarantine and isolate people by group as opposed to one by one. We'll provide detailed outbreak instructions to you. It may require entire cohorts to isolate or to quarantine, or if things are extensive, it may require the closure of the camp for a period of time because everybody at the camp needs to quarantine. We will provide you with outbreak letters that can be sent to camp families to provide additional information, and we'll provide specific guidance on who needs to get tested and who needs to quarantine. We will remain and provide regular communication with you. We'll meet with you a couple of times a week during an outbreak to make sure that you have an ample opportunity to ask any questions you might have. We declare an outbreak over when we've seen no new cases for 14 days from the date of the last positive participant or staff, and when we decide as MLHU that the outbreak's over. There's lots of nuances that go into deciding whether an outbreak should be declared over or not. We have to think and reflect, and we have to take a lot of things into account. Declaring an outbreak and declaring an outbreak over is actually a pretty complicated thing, and so we will walk you through it, but at the end of the day, we get to make the call on that. And we'll work with you to make sure you have an opportunity to answer any questions that you might have. As I mentioned, in very rare circumstances, we may have to close a camp. Sometimes this happens when there's just so much transmission that it's the safest thing for us to close the camp. Sometimes it's because facilities aren't following minimum public health measures that are necessary to protect campers or staff. And so in those instances, we may close the camp. So it's really important that you demonstrate that you understand the importance of infection prevention and control. I will say we rarely close things down. We work with you and we have excellent success with our camps and with other facilities. So I'm really optimistic that we're not going to have to close things, but we do have to work really closely in terms of making sure that these places are safe. We want to help you run these places safely. We do not want to close camps. We like camp. We love camp. We want kids to be in camp, but we want it to be done safely. There are many resources available to you. Please go to www.healthunit.com, click on the COVID-19 tab at the top, and follow the links to the camp resources. In addition to resources for COVID-19, there's also some resources around extreme heat. It's not just COVID-19 that's going to be a problem this summer, it's also going to be extreme heat. And so as a last minute reminder, make sure you've got lots of healthy snacks to help kids make it their way through the day, and make sure that water is available to quench thirst. It's the best choice to stay hydrated. Encourage campers to carry a reusable water bottle, and that way they're not sharing water bottles with each other, but they're also staying hydrated, an absolute key for a successful summer. I'm going to remind you one more time for the people in the back that as we go into this summer and as we bring this pandemic to a close, vaccination is the single most important thing that we can do to prevent COVID-19. Vaccination is safe. Vaccination is effective. Vaccination is what we do for ourselves, for our neighbors, for our communities, for our camps to make things safe. The COVID-19 vaccine is approved in everyone over the age of 12. And we anticipate that it'll shortly be available for kids younger than 12 as well. Getting vaccinated with 2 doses is highly effective, not only against symptomatic COVID-19, but it's nearly 100% effective against severe illness or hospitalization or death. kids tend to do really well with COVID-19, but the family members around them may get very sick despite the fact that the kid is doing well. Vaccination is so important. So for your staff and for your kids and campers who are of age and eligible, promote vaccination. If you have questions about vaccination, also check out our website or give us an email at health@mlhu.on.ca. We're happy to speak to you about the importance of vaccination and answer all the questions you might have. As I mentioned, one more time, vaccination is the single most important thing we can do to prevent COVID-19. Thank you so much for joining us today. If you have additional questions, as I mentioned, email health@mlhu.on.ca or check out our website at www.healthunit.com. We really appreciate all the work that you continue to do to make sure that our community is safe and to make sure that these campers have a summer that is memorable and impactful for them. Camps are a critical part of development and childhood experiences. And for our kids, it's been a really rough year and a half. They haven't been able to be in school, and so for many, these camps will be a first opportunity in a long time to get out and enjoy what it means to be a kid. Thanks for all your work. Let us help you make sure that it's going to be a safe and successful summer. And please, as I mentioned, if you have questions, just give us a call, send us an email. We're happy to be there and work through this with you. Take care, and thanks so much.